Aboriginal and Torres Strait Islander peoples are warned that the following content may contain images and voices of deceased persons. This video has been created to provide Aboriginal and Torres Strait Islander community using BRHS services an understanding of the resources available to support their healthcare journey. BRHS is committed to closing the health gap of Indigenous and non-Indigenous people. Information in this film is designed to ensure you are aware of the incentives available to help provide a culturally safe environment and to improve the hospital experience and healthcare outcomes for Aboriginal and Torres Strait Islander people.
Womaninji, we'd like to acknowledge the Gunai people, the traditional owners on whose land the hospital sits.
We recognise and respect their cultural heritage, beliefs, knowledge, resilience and relationship with the lands. We pay respect to elders past, present and emerging and thank them for their contribution to our health services. To help the community engage with BRHS Regional Health Service, efforts have been made to change the environment and make it feel more culturally welcoming. While some of our biggest Aboriginal health initiatives have taken place in recent years, we look back and recognise our very first Koori Hospital Liaison Officer, Auntie Helen Morgan, who started her role at the hospital in 1982.
When I put in for put in for the job, I was so shy and and all that stuff that goes with it. And oh my goodness, I hope that I can land this job, And I went home after the interviews and everything, and a couple of days later I got the news that, I got the job. My desk was situated down in the hallway there somewhere. Everything sort of changed, I don't know where, but along there somewhere. Every morning I'd do my rounds and go to the desks or into the wards then if there's some Kooris in there, and that didn't stop me from saying hello to non-Aboriginal patients and stuff like that. I really loved it.
From simple beginnings in 1982, our services and initiatives for Aboriginal and Torres Strait Islander patients have grown, and the BRHS Regional Health Service now has its own Aboriginal health unit with a focus on closing the health gap between Indigenous and non-Indigenous people.
The Aboriginal Health Unit is located in the main corridor of the hospital. This team consists of a Koori Hospital Liaison Officer, KHLO, an Access and Support Worker and a Care Coordinator who all have a strong commitment to building culturally responsive care and support at the hospital and in the community to break down barriers for Aboriginal and Torres Strait Islander people accessing healthcare. The Aboriginal Health Unit are here to support your care. Please just ask our staff if you would like a visit. Koori Hospital Liaison Officer are here to provide emotional, social and cultural support to ensure you get the care you need during your stay at BRHS. The Care Coordinator is here to ensure effective hospital discharge with follow-up care to reduce hospital readmissions. The care coordination includes clients with complex health needs to ensure they can access services and information to better manage their health condition. The Access and Support Worker is here to link your services such as My Aged Care, Disability Services, Home and Community Care programs to keep you active in your community or living independently in your home. When patients present to BRHS Emergency Department, a triage or sorting system is used to establish who is prioritised for medical care first. It is vital that patients with greatest health concerns are seen first to reduce the risk of complications. There are 5 categories we triage patients with upon their presentation and symptoms described. 1. Immediately life-threatening. 2. Imminently life-threatening. 3. Potentially life-threatening. 4. Potentially serious. And 5. Less urgent. There is often a waiting time for less urgent patients, but always ask the nurse at the desk how much longer you need to wait if you are concerned. Always let the nurse know if you need to leave prior to being seen. Another important initiative in closing the gap is the correct identification of Aboriginal and Torres Strait Islander patients. We do this by asking all patients the question of origin. Are you of Aboriginal or Torres Strait Islander origin? The healthcare journey starts by asking this question and allows staff to connect Aboriginal and Torres Strait Islander people with pathways that support their healthcare journey. It is mandatory to ask the question of origin. It can be asked at all admission and registration points throughout the hospital or healthcare journey. With your consent, BRHS staff will place either an Aboriginal or Torres Strait Islander flag sticker onto your medical file and on your discharge script for pharmacy. BRHS has specific forms used for Aboriginal and Torres Strait Islander patient admission and discharge. These forms feature targeted questions alerting staff to offer support and services and also ensure family or key workers are notified of your admission. They have been designed to help us get to know you and your preferred name and also gain your consent for specialist support during your healthcare journey. Some of the questions are to establish who your social support of family, friends and community are and the health services and GP you might use.
It's really important that we get this right from the start for our patient's hospital journey, and these forms really help build that rapport and get the key people involved with their care for admission and discharge home.
These forms are used to identify any concerns you might have affecting your stay, like family responsibilities, cultural or spiritual beliefs with illness or death, traditional healing preferences, women's or men's business, work, pets or transport to get home. It might be that you have a habit that makes it difficult to stay or wait. We have support here to help you. Please let us know. These questions help BRHS staff connect you with the right people during your stay and the support services to help get you home and get better. If you have identified as Aboriginal or Torres Strait Islander and have an aged care package, a bright pink label will be placed on the inside of your medical record file. This sticker alerts staff that the patient is on a package and will help to ensure your case manager is aware of your hospital admission. The Warrawee room is located in the main corridor of the hospital next to the Aboriginal Health Unit office. Warrawee is a Gunai-Kurnai word meaning come rest a while. The Warrawee room is a place for Aboriginal and Torres Strait Islanders and their family and friends to use while in hospital. It's a safe space to yarn, gather information, educate, share stories and ideas, or to simply make yourself a tea or coffee. The Warrawee room is available 24 hours a day. Out of hours, please contact the clinical coordinator or ask front reception. To get better, it is important that you understand your health condition and why you have been admitted to hospital. You have the information and service referrals to better manage your condition. You have a key support person during your stay and to help you return home. You feel comfortable with the treatment options and discharge plan. Please let staff know if you need assistance with transport to get home, if you need a medical certificate for work/Centrelink, or if you have any pain or concerns that are worrying you. If you require any day leave to visit a sick family member, access money, pay bills, or attend a funeral, please let us know so we can try and support you. Once the doctor has cleared you for day leave, identified and explained any risks, your mobility has been assessed and equipment provided, this will be documented clearly in your file. You can then sign yourself in and out of hospital. It is vital we know where you are whilst in our care, how and who is taking you, so we can continue to provide treatment around your planned day leave. G1 is Gunai-Kurnai language for the Australian bracken fern, a symbolic plant traditionally used by the Gunai-Kurnai people for its medicinal properties. The G1 script is the name BRHS has chosen to provide free discharge medication for Aboriginal and Torres Strait Islander people leaving our hospital. The G1 Scripts initiative has helped our Aboriginal and Torres Strait Islander community to return home with their medication and the time to see their regular GP for registration to access PBS Medicare Measure Close the Gap scripts. BRHS Pharmacy Department business hours are 8:30am to 4:30pm Monday to Friday and 9am to 1pm Saturday and Sunday. Aboriginal and Torres Strait Islander clients can access allied health services at BRHS at bulk billed concessional rates. Items prescribed during the therapy are not subsidised. However, please let the allied health professional know if you have a worker involved in your care who may have access to funds to cover these costs for you. Alternately, the prescribed item costs can be accessed via other payment options. Please let staff know prior or during your consultation. Aboriginal and Torres Strait Islander patients can access medical imaging and consulting room services via bulk billing. Please speak with staff for more information. Before leaving hospital, it's important that the doctor has checked you are ready for leaving. This is normally done in the mornings, and it is important to ask the doctor or medical staff any questions about your care before leaving. There are things you should consider before leaving hospital, like, do you have a discharge time? Are your personal items packed and ready to go? Have your medications been organised and have staff explained how to take them correctly? Do you have follow-up appointment dates and times for a doctor or specialist? Do you need any home and community care services when you go home? Has this been arranged for your discharge? Do you require a medical certificate for work or Centrelink? Have staff provided you a copy? Do you have a contact number for any questions you might have after you leave hospital? Do you require any equipment to take home to help you walk or attend to personal care? And will you need transport to get home? If you do, please let staff know as soon as possible. BRHS has short-term community support services to help you recover after leaving hospital. This is available for all patients discharging from BRHS. These can include home-based nursing, home help with cleaning, meal preparation and shopping or in-home respite. Services can be arranged to visit you at home, or we can notify your existing services to recommence or increase. Equipment can be arranged to support you to get home, like walking aids, crutches, shower chair or wheelchair, etc. BRHS hire equipment has a deposit cost to borrow with a 30-day free hire period after discharge. Deposits can be negotiated. Please let our staff know if you are experiencing any financial hardship. All palliative clients who require equipment can access these items at no cost through home-based nursing services. When you're leaving hospital, it's important that you're linked with the right type of services, exercise groups or health professionals to help you recover. Staff will need your consent to share your information when making referrals or follow-up appointments on your behalf. Please let staff know if you will need transport to get to these follow-up appointments. It is your choice whether you see a GP at a local ACHO or a mainstream medical clinic. It is important to inform us of your preference so we can send your hospital discharge summary to the right clinic. If you have a case manager or worker supporting you, with your consent, we can let them know you are leaving hospital and your discharge follow-up care required. A healthcare worker or the Aboriginal Health Unit may follow up with a visit or phone call within 48 hours after you leave the hospital with your consent. Working together with local ACHOs is crucial to closing the health gap. BRHS works closely with the 4 local ACHOs through patient referrals, regular meetings, shared events and project collaboration. You may notice BRHS staff have handy ACHO contact cards on staff lanyards. The BRHS is committed to closing the health gap for Aboriginal and Torres Strait Islander people. From the CEO down, Aboriginal and Torres Strait Islander health is a top priority.
Aboriginal and Torres Strait Islander health is everybody's business. We thank you for your time and look forward to working with you on improving health outcomes for our community. So the Gunai Kurnai language for goodbye is Yarrabi. So Yarrabi.